Across India, alarming stories of young, seemingly healthy people dying suddenly from heart attacks are making headlines and sparking fear. These incidents are not isolated. They are happening in cities and towns, in both urban and rural areas. And the victims are often people who appeared to be fit and active. The shockwaves from these tragedies are being felt in every community, leaving families devastated and searching for answers. These tragedies are no longer limited to the elderly. People in their 30s and 40s are increasingly at risk, challenging old assumptions about heart disease. Doctors are now seeing younger patients with heart problems that were once considered rare at their age. This shift is forcing both the medical community and the public to rethink what we know about heart health and who is truly at risk. Social media amplifies the shock, spreading news rapidly and fueling anxiety. Every new case becomes a trending topic, with people sharing stories, theories, and concerns. The constant stream of updates makes it hard to ignore the growing crisis, and many are left wondering if they or their loved ones could be next. In response, the Karnataka government has formed an expert committee to investigate, conducting verbal autopsies to uncover lifestyle, medical, and genetic factors. These experts are working tirelessly to analyze patterns, interview families, and gather crucial data that could help explain why heart attacks are striking younger people. Their findings may shape future health policies and prevention strategies across the country. This is a wake-up call. Heart health can't be taken for granted, no matter your age. Awareness campaigns and community seminars are urging people to get regular checkups, understand their risk factors, and make heart-healthy choices every day. The message is clear. Prevention and early detection are more important than ever. The rise in heart attack deaths demands urgent attention to our lifestyles and health. Factors like stress, poor diet, lack of exercise, and undiagnosed conditions are all contributing to this crisis. By making small but consistent changes, like eating healthier, staying active, and managing stress, we can protect ourselves and our loved ones. Now is the time for informed, proactive action to prevent more lives from being lost. By coming together as a community, supporting each other, and prioritizing our heart health, we can turn the tide on this alarming trend and build a healthier future for all. The surge in heart attack deaths isn't isolated. It's a nationwide crisis that is touching families in every corner of India. From bustling cities to rural villages, the impact is being felt across all age groups and communities, making it clear that this is not just a medical issue, but a social and economic one as well. Karnataka's recent numbers mirror a broader trend: nearly 7,000 heart attack deaths in just 5 months, with over 1,300 each month. These figures are not just statistics. They represent real people, real families, and real communities grappling with loss and uncertainty. The numbers are a wake-up call, highlighting the urgent need for action. Major hospitals report a steady stream of cardiac emergencies, reflecting deeply rooted issues in our modern lifestyle. Sedentary habits, unhealthy diets, rising stress levels, and lack of awareness are all contributing to this alarming trend. The healthcare system is under immense pressure, with doctors and nurses working tirelessly to save lives every day. Bengaluru alone sees over 500 heart attack deaths monthly, showing this is a systemic problem, not a local anomaly. The city's fast-paced life, combined with environmental and lifestyle factors, is creating a perfect storm for heart disease to thrive. The trend has been rising for over a decade, shifting India's health profile and straining our healthcare system. Hospitals are seeing younger patients than ever before, and the burden on medical infrastructure is growing year after year. This is not a problem that will resolve on its own. We must move beyond reacting to isolated incidents and address the long-term underlying causes. This means investing in public health education, early detection and preventive care, as well as supporting research to better understand why heart disease is rising so rapidly in India. Recognizing the true scale is the first step toward effective nationwide prevention and treatment. It requires a collective effort from government, healthcare providers, and every citizen to change the course of this epidemic. Only by facing the reality can we protect future generations from this growing epidemic. Together, we can build a healthier, more resilient India, one where heart disease no longer claims so many lives. Many have speculated about a link between COVID-19 vaccines and heart attacks, But there's no scientific evidence supporting this claim. Leading Indian and global health bodies confirm vaccines are safe, and their benefits far outweigh any risks. In fact, India's vaccination program is estimated to have saved millions of lives. The real threat to heart health is the COVID-19 virus itself, which increases the risk of heart complications far more than the vaccine. Misinformation distracts from the real modifiable risk factors behind India's heart disease epidemic. Let's focus on proven science and address the true causes to save lives. The surge in heart attacks is driven by a mix of lifestyle changes, genetics, and undiagnosed health conditions. Sedentary routines, unhealthy diets, and increased smoking and alcohol use are major contributors. Smoking alone is linked to 60% of heart attacks in young patients. Stress, long work hours, and poor coping mechanisms further strain the heart. South Asians are genetically more prone to heart disease, developing risk factors at younger ages and lower body weights. Many Indians live with undiagnosed high blood pressure, cholesterol, or diabetes, silently damaging their arteries. The lingering effects of COVID-19 and rising air pollution add to the risk. It's this dangerous combination that's fueling India's heart disease epidemic. India's cardiovascular death rate is 282 per 100,000, much higher than the global average. Heart disease now causes over a quarter of all deaths in India, nearly double the rate from 3 decades ago. Indians suffer heart attacks a decade earlier than people in the West, with the average age just 53. This early onset robs families and the nation of productive years, creating a massive social and economic burden. The statistics are not just numbers. They represent real people and families affected by preventable loss. The evidence is clear. We face a formidable enemy in heart disease. Prevention, early detection, and effective management are urgently needed. These numbers are a call to action for every Indian. The good news is that most heart attacks are actually preventable, and it doesn't require drastic changes. Just a few simple steps in your daily routine can make a huge difference. By making small, consistent choices, you can protect your heart and improve your overall well-being for years to come. Start by moving your body every day. Aim for at least 30 minutes of moderate activity. This could be a brisk walk, cycling through your neighborhood, or even dancing with friends. Physical activity not only strengthens your heart, but also boosts your mood, helps control weight, and lowers blood pressure. If you're new to exercise, begin with short walks and gradually increase your pace and duration. Next, focus on what you eat. Fill your plate with a variety of colorful fruits and vegetables, whole grains like brown rice or millets, and lean proteins such as fish, chicken, or lentils. Try to limit processed foods, excess salt, sugary snacks, and unhealthy fats found in fried or packaged foods. Cooking at home more often can help you control ingredients and make healthier choices. If you use tobacco in any form, whether it's smoking, chewing, or vaping, quitting is one of the best things you can do for your heart. The benefits start almost immediately, reducing your risk of heart disease and improving your lung health. Seek support from friends, family, or a healthcare professional if you need help quitting. Managing stress is equally important. Practice yoga, meditation, or simply spend time in nature to relax your mind and body. Also, try to limit alcohol intake, as excessive drinking can raise blood pressure and harm your heart over time. Even small changes, like taking deep breaths or enjoying a hobby, can help reduce stress. Don't forget about sleep. Prioritize getting 7 to 8 hours of quality rest each night. Good sleep helps your body recover, keeps your heart healthy, and improves your mood and energy levels throughout the day. It's also important to know your numbers. Schedule annual checkups to monitor your blood pressure, blood sugar, and cholesterol, especially starting at age 30. Early detection of any issues can help you take action before problems develop. If you're over 40, talk to your doctor about a coronary calcium scan. This simple test can help assess your risk of heart disease and guide you toward the right preventive steps. Remember, protecting your heart doesn't have to be overwhelming. By taking small, consistent steps, like moving more, eating better, quitting tobacco, managing stress, sleeping well, and getting regular checkups, you can build a healthier future for yourself and your loved ones. Recognizing a heart attack early can save a life. Watch for chest discomfort, pressure, squeezing, or pain that lasts or returns. Other symptoms: pain in arms, back, neck, jaw, or stomach, shortness of breath, cold sweat, nausea, or unusual fatigue. If you suspect a heart attack, call an ambulance immediately. Don't drive yourself. While waiting, help the person sit and stay calm. Loosen tight clothing. If not allergic, chewing one aspirin can help. Time is muscle. The faster the treatment, the less heart damage. Educate your family about these signs. It could make the difference between life and death. Combating heart disease requires more than individual effort. It's a collective responsibility. The government must lead with public health campaigns, school health education, and accessible screenings. Introducing health checks in schools and a national registry for sudden deaths can help target interventions. Strengthening primary health care, especially in rural areas, is vital for early detection and prevention. Communities should make healthy choices easy: safe parks, fresh food access, and smoke-free spaces. Together, we can reverse the tide of heart attacks and build a healthier future. Every Indian deserves the chance to live a long, heart-healthy life.